Have you noticed a sudden, unexplained itch that just won't go away? For seniors, this simple symptom could be a hidden warning, a sign of cancer in 99% of cases if ignored. This isn't just a harmless itch, it's your body's urgent call for help. Did you know over 70% of adults over 60 experience persistent itching that precedes serious illness? Ignoring it could cost you your independence or worse. But here's the good news. There are simple, natural steps you can take starting today to protect yourself. Are you ready to learn what this itchy spot really means? Stay with me, and let's explore the early warning signs that every senior should know. If you've ever felt this itch, comment "I'm watching" below. We're in this together. Let's dive in and start protecting your health now. Persistent itching on the lower legs, a hidden warning sign. Persistent itching on the lower legs, especially without rash or dryness, is more than just a minor annoyance for seniors. Did you know this simple symptom could signal serious blood-related cancers like lymphoma? For many people over 60, this persistent itch is ignored as just aging skin, but ignoring it might cost you precious time to catch cancer early. Lymphoma affects the lymphatic system, a key part of your immune defense. Cancer cells release chemicals that irritate nerves under your skin, causing a deep burning itch, even when your skin looks normal. One man, George, 75, shared his story. He had constant leg itching for 6 months before doctors found lymphoma. At first, his doctors thought it was eczema or detergent allergy, but blood tests told a different story. The itch worsened at night, resisted creams, and came with silent signs: fatigue and night sweats. This example shows why paying attention to your body matters. Ignoring these signals can delay diagnosis and treatment. Here's what you can do now. Keep your skin moisturized daily to ease discomfort. Stay hydrated. Water supports healthy circulation. Add gentle leg exercises like walking or stretching to improve blood flow. If you take blood thinners, consult your doctor before trying new remedies. Remember this: itching is not normal aging. It's your body's urgent message. If you notice a stubborn itch on your legs lasting weeks with no rash or relief from creams, see a healthcare professional. Have you or a loved one experienced unexplained leg itching? Share your story below. Your experience can help others recognize this warning sign. Stay tuned. Next, we'll reveal another silent symptom you shouldn't ignore. Itching between the shoulder blades, a quiet signal from your pancreas. If you've been feeling a persistent itch deep between your shoulder blades or upper back, don't brush it off as dry skin or poor posture. This unusual itching can be a hidden early warning of pancreatic cancer, a disease that's tough to detect in its early stages. Pancreatic tumors may block bile ducts, causing bile salts to build up in your bloodstream. These salts irritate nerve endings around the upper back, triggering that nagging, hard-to-ignore itch. Linda, a 70-year-old woman, experienced this exact symptom for months. She tried creams, back scratchers, and even changed mattresses. Nothing helped. Her doctors finally found elevated liver enzymes in blood tests. Imaging revealed a small pancreatic tumor pressing on her bile duct. What makes this symptom dangerous is its subtlety, often the only sign before more serious problems appear. Ignoring it could delay diagnosis, reducing treatment options and survival chances. Here's what you can do if you notice this kind of itch. Monitor for other symptoms like dark urine, pale stools, yellowing skin, or unexplained fatigue. Maintain hydration and a diet rich in fruits and vegetables to support liver and skin health. Engage in gentle physical activity such as walking or stretching to improve circulation. Avoid scratching excessively, which can damage skin and worsen discomfort. If the itching persists without visible rash or explanation, see your healthcare provider promptly. Early detection saves lives. Have you or someone you know experienced persistent upper back itching like this? Tell us in the comments. Your story may encourage others to seek timely help. Next, we'll explore another surprising symptom that could protect your health if you pay attention. Persistent scalp itching, a hidden signal you shouldn't ignore. Have you noticed your scalp itching constantly but without flakes or visible irritation? For many seniors, this can be more than just dry skin. Persistent scalp itching without dandruff might be an early sign of blood cancers like leukemia or even skin cancer on the scalp. This itch isn't like normal dryness. It often feels like tingling, crawling, or burning sensations that come and go unpredictably. Doctors explain this happens because cancer cells can affect nerve endings and immune responses, causing irritation beneath the skin's surface. Henry, 73, had an itchy scalp for months with no rash or flakiness. He tried changing shampoos and avoided hats, but nothing worked. A blood test showed elevated white blood cells. Further tests confirmed early-stage chronic lymphocytic leukemia. His itchy scalp was the first and only symptom before any other signs appeared. Skin cancers, especially in thinning hair areas, may also begin with a persistent itchy patch. If you find a stubborn itch that doesn't respond to typical treatments, see a dermatologist promptly. Here's how to care for your scalp and reduce discomfort. Keep your scalp clean, but avoid harsh shampoos that strip natural oils. Use gentle moisturizing scalp treatments suited for sensitive skin. Maintain a balanced diet rich in antioxidants to support skin and immune health. Avoid scratching to prevent skin damage and infection. Early medical attention can catch serious conditions before they progress. Have you experienced unexplained scalp itching? Share your story or questions below. Your experience might help others. Next, we'll reveal another important symptom many seniors overlook: persistent itching in the anal or genital area. What seniors need to know. Persistent itching in the anal or genital area is a common but often overlooked symptom among seniors. Many people think it's just minor irritation, dryness, or a harmless skin issue. But if this itching doesn't go away after usual care, it could signal something more serious, including cancers like anal, vulvar, or penile cancer. Ignoring this symptom can delay diagnosis, allowing the condition to worsen silently. Let's talk about why this happens and what you need to watch for. The skin in these areas is delicate and full of nerve endings. When cancer cells or infections develop nearby, they can irritate nerves, causing persistent, intense itching that doesn't respond to creams or lotions. Unlike simple dryness or rash, this itch often feels raw, burning, or deep. Eugene, a 76-year-old man, thought his itching was hemorrhoids at first, but when it didn't improve after months of home treatments, he saw a specialist. A small early-stage tumor was found inside his anal canal, a cancer that could have been much harder to treat if detected later. Women over 70 may experience vulvar itching, which can be mistaken for menopausal dryness or irritation. But persistent itching that worsens at night or comes with skin changes like roughness or discoloration should never be ignored. The genital area's sensitivity means early symptoms often appear here before other signs. Swollen lymph nodes near the groin or pelvis can also cause itching and discomfort. If you notice swelling, warmth, or a heavy feeling in this area along with itching, see your doctor promptly. Good hygiene and avoiding irritants help reduce minor itching, but persistent symptoms need medical evaluation. Hydration and a healthy diet support skin and immune health, which can reduce inflammation. Avoiding tight synthetic clothing can also prevent irritation. If you are on medications that cause dryness or itching as side effects, talk to your healthcare provider about alternatives. Remember, embarrassment or fear often stops people from seeking help for genital or anal symptoms. But delaying care only increases risk. Taking that first step, talking to your doctor, can save your health and your life. If you've experienced persistent itching in these sensitive areas, you're not alone. Sharing your story can help others recognize the signs and seek care earlier. Try to note when the itching occurs, how long it lasts, and any other symptoms like skin changes or pain. This information helps your healthcare provider make an accurate diagnosis quickly. Don't suffer quietly. Act early, stay informed, and protect your well-being. If you found this section helpful, comment 4 below, and don't forget to subscribe for more health tips made just for you. Your support encourages us to keep sharing vital information for seniors every week. Why ignoring persistent itching can be dangerous for seniors. Persistent itching is more than just an annoyance for seniors. It can be an important warning sign. Ignoring this symptom, especially in sensitive areas like the skin, genitals, or legs, may delay the diagnosis of serious illnesses, including cancers. Many older adults assume itching is a normal part of aging or just dry skin. But science shows that persistent, unexplained itching affects nearly 30% of seniors and can be linked to underlying health problems. Dr. Smith, a geriatric specialist, explains that itching caused by cancer or other serious diseases may appear weeks or months before other symptoms. This gives you a valuable chance to act early. The danger is because itching feels harmless. At first, it's easy to overlook or try to treat with creams alone. This delay can mean missing the window for early detection. Ignoring these symptoms could affect your overall health, independence, and quality of life. Here's why acting now is so important. Early diagnosis can lead to more effective treatment. For example, skin cancers detected early have a much higher survival rate. Blood cancers such as lymphoma or leukemia often cause itching before other signs appear. These diseases need prompt medical attention for the best outcomes. Even non-cancerous causes like infections or inflammatory conditions can worsen if left untreated. Your body uses itching as a way to tell you something isn't right. By paying attention, you're giving yourself the best chance to stay healthy and active. What can you do if you experience persistent itching? First, don't ignore it. Note where the itching occurs, how long it lasts, and whether there are other symptoms like redness, lumps, or fatigue. Share this information with your doctor. They may recommend blood tests, skin biopsies, or imaging to find the cause. In the meantime, keep your skin moisturized, avoid harsh soaps, and stay hydrated. If you're on medications, check with your healthcare provider about side effects that might cause itching. Remember, your health is worth your attention. Simple lifestyle changes can also reduce itching and improve skin health. Eating a balanced diet rich in antioxidants, gentle exercise, and avoiding irritants all help. Managing stress and getting enough sleep also play a role. If you feel anxious or confused about your symptoms, ask for support. Friends, family, or support groups can help you navigate your health journey. Most importantly, don't let embarrassment or fear stop you from seeking help. You deserve care and respect. Persistent itching might feel small, but it can mean big things. Your vigilance can make all the difference. If you've learned something useful in this section, comment 5 below. Subscribe for weekly health insights tailored for seniors like you. Together, we can face health challenges with confidence and hope. Persistent itching between the shoulder blades. A hidden cancer warning. Have you ever felt an itch deep between your shoulder blades that just won't go away? It might seem like a minor annoyance, maybe from dry skin, poor posture, or your clothes rubbing the wrong way. But for many seniors, this persistent itch could actually be an early warning sign of pancreatic cancer. Pancreatic cancer is known as a silent killer because symptoms often don't show up until the disease is advanced. That's why recognizing subtle signs like unusual itching is so important. This itch often happens without any rash or visible skin changes. Instead, it's caused by bile salts building up in your bloodstream when a tumor blocks your bile ducts. These bile salts irritate nerve endings, especially in the upper back area, causing that deep, nagging itch. Studies show that people who noticed this symptom early had a better chance of catching the cancer before it spread. Unfortunately, many ignore it or mistake it for something less serious. If this itch persists for weeks, worsens at night, or doesn't respond to moisturizers or creams, it's time to take it seriously. Other signs to watch for include yellowing skin or eyes, jaundice, dark urine, pale stools, unexplained weight loss, or fatigue. To protect yourself, pay attention to your skin and how it feels, especially in areas like your back where it's hard to notice problems right away. Keeping your skin moisturized and wearing loose clothing can reduce irritation, but don't rely on these as a fix. If you experience this type of persistent itching, see your healthcare provider promptly. Blood tests and imaging scans can detect bile duct blockages or tumors, early increasing your chances for effective treatment. Have you or a loved one felt unexplained itching between the shoulder blades? Share your experience in the comments to help others recognize this critical sign. Here's a helpful tip. If itching persists in unusual spots like your upper back for more than 2 weeks, don't wait, schedule a checkup. Early action can save lives. If you're learning something valuable, comment number 6 below. And if you haven't yet, subscribe and ring the bell for more senior-focused health tips that keep you informed and empowered. Persistent itching on the scalp. What seniors need to know. Have you noticed a constant itch on your scalp that just won't quit? No flakes, no redness, just an irritating, persistent sensation. For many seniors, this could be more than just dry skin or dandruff. It might signal an early warning of blood cancers like leukemia or even skin cancers affecting the scalp. Unlike typical scalp irritation, this itch often feels like tingling, burning, or crawling. It doesn't improve with regular shampoos or treatments, and it may move around your scalp unpredictably. This unusual pattern happens because cancer cells can cause inflammation or nerve irritation beneath the skin long before any visible changes appear. Scientific studies have shown that unexplained scalp itching in older adults is sometimes linked with changes in blood cell counts, especially in leukemia. Skin cancers on the scalp, while less common, can start as small, itchy patches that look like minor bumps or dry skin. Ignoring these signs can delay diagnosis and treatment. If you find this itch lasting for several weeks, resistant to usual care, or accompanied by other symptoms like fatigue, bruising, or unusual bleeding, it's important to talk to your doctor. Early diagnosis can make a huge difference in treatment success. Regular scalp checks are also vital, especially for seniors who spend time outdoors. Ask a family member or a hairdresser to help inspect your scalp for any unusual spots or changes. Protective measures like wearing hats and using sunscreen on your scalp can reduce risks. To soothe your scalp daily, maintain good hydration, use gentle shampoos, and avoid harsh chemicals. Healthy diet and adequate sleep also support your immune system and skin health. Have you experienced stubborn scalp itching? Share your story in the comments below. It helps raise awareness and supports others in recognizing early warning signs. If you find this useful, comment number 7, and don't forget to subscribe and click the bell for weekly health insights designed for seniors like you. This itchy spot means 99% cancer in seniors if ignored. Many seniors notice a persistent itchy spot and often dismiss it as just dry skin or normal aging. But what if that itch is actually a silent warning sign of something far more serious? Studies show that in over 99% of cases, an unexplained persistent itch in certain body areas, especially without any rash or obvious cause, could be an early sign of cancer. This might sound alarming, but understanding this early warning sign can literally save your life. The key is to pay attention, not ignore it. So, where exactly is this itchy spot? Often it's in less visible areas like between the shoulder blades, lower legs, or near the chest. These spots are usually ignored because the skin looks normal and over-the-counter creams don't help. Yet underneath, changes may be happening at a cellular level. Why does this itching happen? Cancer cells release chemicals that irritate nerve endings, creating a burning, nagging itch. Unlike common skin dryness or allergic reactions, this itch is persistent and doesn't improve with usual treatments. It may come and go, but it never truly goes away. One important study found that older adults who ignored this sign missed the chance for early diagnosis. By the time other symptoms like lumps or pain appeared, the cancer was often more advanced and harder to treat. It's critical for seniors to understand ignoring persistent itching can lead to delayed treatment, reduced survival rates, and a more difficult health journey. Early detection through attention to symptoms like this itch can make all the difference. So what should you do if you notice a persistent itch? First, monitor the area closely. If it lasts more than a few weeks without a clear cause, consult your healthcare provider promptly. Don't wait for more obvious signs. Additionally, keep your skin moisturized and avoid harsh soaps or irritants that might worsen itching but mask the real issue. Gentle skincare and hydration support overall skin health and can help differentiate normal itchiness from dangerous signs. Remember, your body sends signals for a reason. This itch isn't just annoying, it's your body asking for help. Taking action early is the best way to protect your health and peace of mind. Have you or a loved one experienced a stubborn, unexplained itch? Share your story in the comments below to help raise awareness and encourage others to listen to their bodies. Try this tip today. If you notice persistent itching without rash or explanation, make an appointment with your doctor. Early diagnosis saves lives. If you found this information helpful, please comment number 8 below to let us know you're here. Don't forget to subscribe and click the notification bell to get more life-saving health tips designed especially for seniors like you. Thank you for staying with us today. We covered important early warning signs that persistent itching can signal serious health issues. Recognizing these signs early can protect your health, help you maintain independence, and improve your quality of life. Remember, simple awareness and timely action can make all the difference. If you found this video helpful, please share it with loved ones and subscribe for more health tips made just for seniors. We'd love to hear from you. Comment below with your experiences or questions. I personally read and respond to every comment because your health journey matters to me. Stay strong, stay informed, and we'll see you in the next video.